a major rift has emerged within the Republican Party, pitting President Donald Trump against his former Vice President, Mike Pence. What was once a united front on healthcare policy has now fractured, revealing deep divisions over how to tackle one of the most pressing issues facing the nation today. The battleground, the soaring cost of prescription drugs, a crisis for millions of Americans. For many families, the price of life-saving medications has become a monthly struggle, forcing impossible choices between paying for medicine or other essentials like rent and groceries. The pain is felt most acutely by seniors on fixed incomes and parents caring for sick children, but the ripple effects touch nearly every household. Trump's new policy aims to dramatically lower medication prices, but Pence's group, Advancing American Freedom, is fighting back, calling it socialist price controls. The debate has spilled out of Washington and into the streets, with protesters demanding relief and advocacy groups warning of unintended consequences. Both sides claim to have the best interests of the American people at heart, but their visions for the future of healthcare couldn't be more different. This isn't just a policy debate, it's a clash over the role of government in healthcare and the future of medical innovation. Lawmakers are locked in heated arguments, while doctors and patients anxiously await the outcome, knowing that the decisions made here could impact access to treatments for years to come. The heart of the matter, Trump's most favored nation, MFN rule, which would ensure the US pays no more for drugs than other wealthy nations. Supporters argue this would finally bring fairness to American consumers who have long paid the highest prices in the world for the same medications available elsewhere for less. The administration says this stops Americans from subsidizing global healthcare. They argue that for too long, US patients have shouldered the burden of high prices, effectively funding research and development that benefits the rest of the world. By tying prices to those paid by other countries, they hope to level the playing field and bring immediate relief to struggling families. Pence's camp warns it's government overreach that could stifle new cures. They argue that price controls, no matter how well-intentioned, could sap the resources needed for innovation, slow the development of breakthrough treatments, and ultimately harm patients in the long run. Pharmaceutical researchers and scientists echo these concerns, worried that the US could lose its edge as a leader in medical discovery. The stakes are high, affecting everyone from seniors to parents of sick children. For some, the outcome could mean the difference between affording a critical medication or going without. For others, it's about ensuring that the next generation has access to cutting-edge treatments and therapies that haven't even been invented yet. The outcome could reshape not just drug prices, but the very principles guiding American healthcare. As the debate rages on, the nation watches closely, knowing that the decisions made in this moment will echo for decades, impacting not only what we pay at the pharmacy, but how we define fairness, innovation, and compassion in our healthcare system. The Most Favored Nation, or MFN policy, is a bold approach to tackling one of America's most persistent problems, the high cost of prescription drugs. At its core, the MFN policy sets a price ceiling, meaning there's a maximum price that can be charged for certain medications purchased by the government. This ceiling isn't arbitrary, it's directly tied to what other wealthy countries pay for the same drugs. Under MFN, drug companies must sell to the US government at the lowest price they offer any other developed country. If a pharmaceutical company gives a better deal to Germany, Canada, or Japan, the US gets that same price too. The goal is to ensure Americans aren't paying more than anyone else for life-saving treatments. Right now, Americans pay far more for the same drugs than people in Canada, France, or Japan, countries that negotiate aggressively for lower prices. In fact, it's not uncommon for a medication to cost 2 or even 3 times as much in the US as it does abroad. This price gap has frustrated patients, doctors, and policymakers for years. In response, President Trump's plan, announced in 2025, secured deals with major drug makers to slash prices for popular medications like Ozempic and Wegovy for Medicare and Medicaid patients. This was a landmark move, aiming to bring U.S. drug prices in line with those paid by other developed nations, and to provide immediate relief for millions of Americans who rely on these medications. The MFN rule wouldn't just apply to existing drugs, it would also cover all new drugs as soon as they hit the market, setting a new standard from launch. This means that from day one, new treatments would be subject to the same international price comparisons, potentially saving billions in healthcare costs over time. Supporters of the MFN policy argue that it finally ends the era of Americans subsidizing global research and development. They say US patients have been footing the bill for innovation, while other countries benefit from lower prices. By tying prices to the global market, they believe the system becomes fairer for everyone, but critics see things differently. They call MFN a form of government price control, warning that it could stifle competition and innovation. Some worry that drug companies might respond by raising prices abroad, cutting research budgets, or even limiting access to new medicines in the US. The real fight is over whether MFN is a fair price guarantee that protects consumers, or a government-imposed cap that threatens the future of medical breakthroughs. This debate is playing out in Congress, in the media, and in households across the country. This fundamental disagreement is fueling a split within the Republican Party, with some lawmakers supporting the policy as a way to lower costs, and others opposing it as an attack on free market principles. The answer to this debate could redefine how drugs are priced in America, shaping the future of healthcare for generations to come. Pence's group, Advancing American Freedom, is leading the charge against MFN, branding it socialist price controls. They argue government-set prices distort the market, threatening the profits that fund new cures for diseases like cancer and Alzheimer's. The AAF warns that price controls will slow innovation, costing lives in the long run. Instead, they call for more competition and less regulation to lower prices naturally. By using the word socialist, they challenge Trump's conservative credentials and draw a sharp ideological line. For AAF, importing European-style price setting is fundamentally un-American. This is more than a policy dispute. It's a battle for the soul of conservatism. AAF's opposition to MFN rests on two fears: stifling US medical innovation and giving China a strategic edge. They argue America leads in biotech because high profits fuel risky research and startups. MFN, they say, would cap profits, drying up investment and slowing new drug development. The group warns that if the US market becomes less attractive, innovation and jobs could shift to China, which is eager to dominate biotech. Their ad campaign frames MFN as a win for China and a loss for American leadership. The debate is no longer just about drug prices, it's about economic security and global competition. Pence's group is rallying conservatives to protect American innovation from foreign rivals. The Trump White House rejects the socialist label, insisting MFN is about restoring fairness, not imposing price controls. They argue Americans, just 4% of the world's population, shouldn't shoulder 75% of global drug R&D costs. Other countries negotiate low prices knowing US patients will make up the difference. Trump's team says MFN uses America's market power to force a global rebalancing, making wealthy nations pay their fair share. The administration claims this is smart negotiation, not socialism. They dismiss fears of crushed innovation, arguing drug companies will still profit, just more evenly across the globe. The real target, they say, is excess corporate profit, not life-saving research. For Trump, MFN is about ending an unfair system, not undermining the free market. The Trump administration frames MFN as a push for global fairness, not just lower prices. They argue medical breakthroughs benefit the world, so the cost should be shared by all wealthy nations, not just Americans. MFN is a message to Europe and Japan: pay your share, or risk losing access to US-developed medicines. The White House believes this pressure will force other countries to renegotiate, spreading R&D costs more equitably. For Trump, this is America First in action, standing up for US patients and taxpayers. The administration paints Pence's group as defenders of a broken status quo that favors foreign interests. The debate is now about who truly represents American families. For ordinary Americans, MFN could mean real savings, especially for seniors and those with chronic illnesses. Drugs like Ozempic and Wegovy, which can cost over $1,000 a month, could become far more affordable under the new policy. The MFN rule would also lower costs for many cancer and arthritis treatments covered by Medicare. For some, this could be the difference between affording medicine and going without, but Pence's group warns, lower prices now could mean fewer new drugs in the future. The central dilemma: immediate relief versus the risk of slower medical progress. The stakes are personal. And the trade-offs are real. Behind the politics, high drug prices are a daily crisis for millions, forcing patients to ration insulin or skip doses to make ends meet. When people can't afford medicine, they get sicker, leading to costly hospital stays and worse health outcomes. The Trump policy is a direct response to this pain, betting voters want relief now, not promises of future innovation. Pence's argument for protecting profits is a tough sell to families struggling to pay for life-saving drugs. The debate is about priorities, affordable access today, or incentives for tomorrow's cures. For many, the answer depends on whether they can fill their next prescription. The MFN fight is about more than policy. It's about real lives. The Trump-Pence clash is more than a political feud. It's a pivotal moment that could reshape the very identity of the GOP and the future of American healthcare. What's at stake isn't just party loyalty or political power, but the real lives of millions of Americans who depend on affordable medicine. As the nation watches, the debate has become a symbol of the deep divisions running through Washington and the country at large. Congress now faces a historic decision on the MFN policy, caught in the crossfire between Trump's enduring popularity with the Republican base and the party's traditional commitment to conservative economic principles. Lawmakers are under intense pressure from lobbyists, constituents, and party leaders, each demanding a different outcome. The stakes are high, and every vote could tip the balance. If MFN passes, millions of Americans could finally see relief from soaring drug costs, making life-saving medications more accessible for families, seniors, and those with chronic illnesses. But the path forward is fraught with obstacles. Powerful pharmaceutical companies are already preparing lawsuits, and industry backlash could stall or even reverse progress. On the other hand, if the policy is blocked, high prices will continue to burden patients, forcing many to make impossible choices between their health and their finances. The frustration and anger among the public could reach a boiling point, fueling demands for even more sweeping and radical reforms in the future. This debate is more than just a legislative battle. It's a microcosm of America's ongoing struggle to find the right balance between free market innovation and government intervention in healthcare. The outcome will send a powerful message about the nation's values and priorities. The decision will not only determine the price of prescription drugs, but also influence the pace of medical innovation, the quality of patient care, and the global reputation of the American healthcare system for years to come. As this political battle rages on, the health security and financial stability of millions of families hang in the balance, waiting for leaders to choose a path forward. Ultimately, the decision Congress makes will define what kind of healthcare system America chooses for the 21st century, and what kind of country it wants to be.